Have two topics, and the first topic, my first slide, is underutilization of palliative care and hospice services. The problem we have is that helping people with advanced illness live as well as possible until they die is one of healthcare's most important jobs, but regrettably one of its biggest failings in the United States. Far too many people do not die how they wish, which is pain-free as possible and at home, surrounded by family. Two beneficial services for patients with advanced illness are palliative care and hospice, both of which are designed to provide comfort care, for example, pain control, as well as emotional support for patients and their families. Here's one fact, it's a sobering fact. 60% of patients who could benefit from palliative care don't receive it, 60%. Here's another fact. 25% of hospice patients die within 3 days of enrollment in hospice, even though insurance covers hospice for 6 months. So we have an opportunity in marketing because when delivered well, palliative care and hospice help people live better until they die. So how can marketing help improve utilization of these valuable services? Well, utilization of these services, hospice and palliative care, actually is right in marketing's wheelhouse. There are complex reasons for underutilizing these services, but we in marketing can help. I do a lot of my own work now in cancer care, and the very first article I wrote in studying cancer care was how we could rebrand palliative care because it's an awful brand name. And I wrote it in an oncology journal. It's a pure marketing paper. It just happened to appear in an oncology journal. So let's go to the next slide and talk about the next opportunity, big opportunity for us in marketing to contribute to, and that's poverty and health. The problem here is that the social determinants of health, for example, quality of housing, quality of education, income levels, nutrition, physical activity, social support, the social determinants of health are far more influential in overall health and length of life than medical care. Here's a fact. It's a stunning fact. It's a sobering fact. The life expectancy in a low-income Chicago zip code drops 16 years compared to an affluent zip code in Chicago. And this is similar in other cities in America. So the opportunity we have is we can play in marketing a much stronger role in innovatively addressing the social determinants of health. For example, in one of my last papers, I wrote about the design of purpose-designed communities. And an example I used was Villages of East Lake in Atlanta, Georgia. This is a new community. It was developed on a site where a public housing project had been. And new market rate and subsidized townhouses and apartments were built. And they were built for a diverse mix of lower and middle income families. A new school was built, retailers came into the area, and this worked beautifully. And we're doing this in dribs and drabs around the country today. Marketing needs to play a more proactive role in projects like this. It's like designing a new complex product, designing a new community like this. So in closing, look, poverty is an overwhelming issue, and it just doesn't seem practical to address it. But if we break it into pieces, if we break the puzzle into pieces and take one part of poverty and its relationship to health, we can, in research groups, we can make a big contribution. The only way we're really going to improve healthcare in America is first to invest a lot more marketing muscle, a lot more of our intellect, a lot more of our aspirational work into improving health itself.